Good morning or good afternoon,
Yeah.
and welcome to Ask the Docs, a Fertility Institute of Hawaii live stream. October is Hawaii Pride Month, and our topic is LGBTQIA plus fertility options. Thank you for joining us today. We have a lot of great information to share with you. My name is Dr. Emily Goulet. I'm here with our fantastic physician associates, Trisha Wall,
Hi.
and our brand new PA, Caitlin Corbett.
Hi.
All right. So we have a lot of topics we wanted to discuss today as far as family building options that are now available to all of the families worldwide. So let's get started with talking a little bit about our ovulation induction cycles, which many of our couples utilize.
Yeah, so our ovulation induction cycles, these are for our same-sex female couples. And something to touch on just before you have your initial evaluation, that's a great thing to start thinking about when you're thinking about family planning, is whose eggs do you want to use, who's going to carry the pregnancy, how many children might you want, do you desire that children are genetically related to both partners, and with donor sperm, would you desire that the same donor sperm is used for each child? So I think that's a great starting point when you're thinking about family planning and family planning goals. And then our team during your evaluations can help guide you to the best treatment plans and evaluations that would be needed based on that. Ovulation induction is one of the two general treatments we offer. For ovulation induction, that's when one partner would be using their eggs and carrying this pregnancy, and we can use medications to help induce ovulation of even more than one egg, maybe 1, 2, or 3, and that's going to increase your chances of pregnancy. And then we utilize donor sperm to do an intrauterine insemination at the time of ovulation. The other options could also be IVF, such as a co-IVF, when we make embryos. We're using one partner's eggs, create embryos in the lab, and then in the future can transfer that embryo into the other partner.
Very good. So for our same-sex female couples, we're looking into ovulation induction. What are the success rates throughout their treatment cycles?
I think for each intrauterine insemination, it's about a 20% success rate for each one. So it does sometimes take more than one try. It's pretty equivalent to the general population. It's not 100% chance per month. We all, based on our ages as well, can have a 15 to 25% chance per month for pregnancy.
Right. And one thing that I like to tell my patients is that in these same-sex couples, there is not an infertility diagnosis, right? And so they generally have even higher rates of success compared to other couples that we may see here at FIA. So that's one of the really nice things. And we generally tell patients that we might try this for 3 or 4 times before we regroup and talk about, if you're not pregnant yet, other things that we can do to get more aggressive to increase the chances of pregnancy. Now, you had mentioned donor sperm. What if we have a relative or a good friend that we want to use their sperm? What if they volunteered and are happy to be the sperm donor?
Yeah, that's a great question. So when it comes to donor sperm, there's the known donors, and then you can utilize anonymous donors through sperm banks. But when you use a known donor, there are a few more steps in the process, and our office is glad to help you through that. But the first thing you want to do is get a semen analysis for that known person to ensure that their sperm is of good enough quality in order to do these treatments. And then after that, we would have to go on to get a legal contract with a lawyer. There's some FDA requirements to do certain blood work and screening tests that we'd have to do as well to make sure that you're a good match and everything.
And that's a good point. If you're using a commercial sperm bank where the sperm donor is anonymous, the FDA requires certain safety things be put into place, and we do our best to strive to meet those same things. So, for example, we require all of the same STI testing that would typically be run. That legal paperwork is important because legally they are the biological father of the child and could be responsible for things like child support. Not that you would necessarily, ask them to pay it, but the government might come and say, oh, wait, where's the father and how come he's not paying child support? So these legal documents are important because they protect all of the parties involved from anybody else trying to interfere with the families that we are building. And then with the anonymous sperm banks, we've got a lot of different options available to us now. There are dozens of sperm banks across the nation.
Not in Hawaii, though.
None are in Hawaii, that is true. And we list the major ones on our website, the ones that we see most of our patients utilize their sperm from. As long as they are FDA certified, we here at FIH are happy to work with them. So if you find your dream sperm donor at a niche sperm bank that has limited use, we're more than happy to get the paperwork done and everything in order to help make sure that we can use that sperm donor of your choice. With the anonymous sperm banks, I tell my patients they're similar to dating websites where they list the profiles of all of the sperm donors, and you can filter based off of height and education and eye color, hair color, and try to get a feeling for which sperm donor might have attributes that you might want to be passed on to your offspring. And so the different sperm banks will have different marketing options and things that they're targeting. Some of them have a celebrity look-alike feature. Others have non-anonymous, essentially, an open ID feature where after the child becomes an adult at the age of 18, they will release the contact information of that donor so that the child, now adult, can reach out and have a short, maybe 30-minute, hour-long conversation to learn about that side of their genetics. It's not meant to establish a relationship, but it is meant to help answer some unfulfilled questions that your child might have when you utilize a sperm donor. But since each of the sperm banks feature different qualities and different attributes, most of them have a free registration. So you can go online, create a login, start to browse the profiles. The sperm banks may not allow everyone to see all of the details about their donors unless you subscribe, and those subscriptions are typically a few $100s for a 3-month period. But once you get the feeling for which sperm bank caters to what you care about most, you can say, okay, this is the one that I'm going to go and get a registration with.
Yeah, something to look at when you're looking at sperm donors is they do some testing on the donors that are really important. So we always tell our patients, don't order it until you've kind of reviewed that with us. Things like genetic carrier screening and CMV status, those are all important when we're looking at the donors to make sure that they're a good match for you to work with.
Those are great. Can you talk to us a little bit more about what CMV is? Because that's a frequent question.
So CMV is a virus that actually most of us have been exposed to, causes kind of like cold-like symptoms in a normal, healthy adult. And if you've been exposed to it, then there's no issue. If you're CMV positive, meaning you've been exposed at some point in your life, you can actually use positive or negative donor sperm. And because there's no risk of reinfecting yourself with it. There is a theoretical risk, though, if you are CMV negative, meaning you've never been exposed to that virus, that doing an insemination with donor sperm that is CMV positive could make you have an infection. And CMV actually can cause some major issues during pregnancy. And so that's why we just like to make sure that if you have never been exposed to it, that maybe we try to stick with a CMV negative donor so that there's not that risk of exposure.
And that's a good point. A lot of my patients ask, well, what harm can it be for the pregnancy? And even though the transmission rates are very low, the cause can be catastrophic and devastating. CMV in particular, if you catch it for the first time in early pregnancy, which is what happens at an IUI, can cause severe neurodevelopmental and cognitive delay and problems with the child. So CMV is the leading cause of the leading infectious cause of mental retardation in infants and children. And it's one thing that can perhaps be mitigated by this risk reducing strategy of choosing a CMV negative donor if you're a CMV negative. But then you also mentioned genetic carrier screening.
Yeah. So genetic carrier screening is much more popular now. I think we kind of do it on most of our patients these days. And it's a blood test that checks to see if you're a carrier of certain genetic disorders. So things like the most popular ones that you've heard of probably are cystic fibrosis, muscular dystrophy, genetic anemias, and those can be passed on more likely if both genetic providers to the pregnancy are positive for the same gene. So if your sperm donor tests positive for one of these diseases, then we would want to check you to make sure that you don't also test positive, because then it gives you about a 1 in 4 chance of having a child with that disease. And so some of them may be not as serious, but still just having the knowledge of that and being able to choose a donor that does not have anything that you might carry can be really beneficial.
That's a great point. And then how does that affect our female same-sex individuals? Do they both need to get tested?
It would not both, unless they're both going to be utilizing the same donor sperm. So it would really just be whoever the egg source is going to be. That's where the genetics is coming from, and that's who you want to test at that time.
That makes sense. So we've talked a little bit about inseminations, and I know that you have mentioned the oral medications, but what is the actual insemination process like?
Yeah, that's a great question. So the insemination process is, so we would have you ship the sperm to our facility, and we will help guide you on when that would be the best time to do it. And once you're ready to ovulate, which we track with ultrasounds and blood work, and sometimes we give an injection medication to help trigger the ovulation, we set up your insemination. So you would come to the office at the time you're scheduled for, and it's a pretty quick 5-10 minute procedure where we use a speculum. Like when you start off with a pap smear, we take a tiny catheter, put it through the cervix, and just inject the concentrated sample of the sperm into the uterus right around ovulation.
And I know no lady likes the speculum, but we do have different sizes and shapes of speculums here, and we are very conscientious of, especially for our same-sex couples, which speculums would be the more appropriate speculum to use. So we are mindful of that. But inseminations aren't our only option.
Right.
We also have the option of co-IVF, family building.
So co-IVF, as Caitlin kind of mentioned it before, is when we get eggs from one partner and make embryos using donor sperm, whether that's anonymous or known donor, and then we take those embryos and we put them into the other partner, who will then carry and deliver the pregnancy. It's an interesting, really cool way for both partners to be part of the same pregnancy, physically part of the pregnancy. So we do have a lot of patients that do that. Unfortunately, insurance will not cover co-IVF generally. And so that can be, much more expensive than patients trying to do IUIs or inseminations.
Yeah, that is true. But it's I think, a really neat way to have both a genetic mother and a gestational mother. And at that point, both of the women become our patients. And so if you are interested in co-IVF and would like to set up an appointment to discuss what the process is, what's involved, exactly how much it costs, please reach out and set up an appointment, and set up an appointment for both of you, because both of you will need evaluation. The genetic mother for the ovarian reserve, because that's the individual that is going to be undergoing the stimulation and the egg retrieval. And then the other one, because the gestational mother will need to carry the pregnancy. So we're going to want to check out and make sure that the uterus is as primed as it can be, and is a great place for us to drop off an embryo to find a cozy little home.
Yeah, absolutely.
Yeah.
And I think we were going to talk a little bit about some male options. That's okay.
Yes.
Are we good?
Yeah, let's
Moving
talk
on to
about
that?
some male options.
So I think probably less options for our male patients, our male same-sex couples. They obviously don't have eggs, and so we need to get an egg source. That would be the first kind of step. But all the steps can be done together, because some steps may take longer than others. But looking for a donor egg is one step that they need to do. And so donor eggs, same thing as donor sperm. We can do known donor family member, friend versus anonymous donor. Same thing goes for known donor eggs as the sperm. There's extra steps that need to be taken. The FDA really regulates this stuff, and so we need to make sure that there's infectious disease screening that's done appropriately, making sure that that's a healthy person so that the donor egg source is a good source for the couple. For anonymous donor egg, there are also a couple different options, and so I would say most of our patients, but not all, will do frozen eggs, and that's just because they're readily available, and so we already have them. We can cycle them pretty quickly. We can make embryos quickly, and so that is done through an egg bank where the donors have already been screened, they've been tested. Same thing, genetic testing. We want to make sure that those donors are really great egg donors, meaning they're going to give our couples a high chance of pregnancy. And so we do all of that screening before cycling them. They go through the process, we get their eggs, and then they're frozen. Usually when you're doing the frozen egg cycles, you get about 5 to 7 eggs in a lot. And then that's intended, I think, to make one pregnancy. And so a reason why somebody might do an anonymous fresh cycle, which means that we don't have the eggs already, is maybe they know that they want more than one child. And so doing a fresh cycle, the difference is you get all of the eggs that donor makes instead of the 5 to 7 lot. And so that might be something that our couples are interested in.
Yeah, that gives you the benefit of having genetically related all from the same egg donor, versus even if you're planning on having, 2 kids, when you come back for that next batch of frozen eggs, that donor may not
be available.
Exactly.
Yeah, absolutely. And I think that, using a fresh donor can definitely be beneficial for a lot of our male couples because they desire to fertilize maybe half of the eggs with one partner's sperm and half of the eggs with another partner's sperm. And so it really gives them both a chance to fertilize and make embryos with their sperm. And then, once embryos are made, they're usually frozen again because the next step can take a little bit longer, and that's finding a carrier for the pregnancy. So male patients obviously don't have a uterus to carry the pregnancy, and so we need to find a gestational carrier to do that for them. Gestational carriers are women that are healthy and that have had previous pregnancies, that have successfully given birth, that then elect to carry a pregnancy for another couple. And there are other reasons that people use gestational carrier, but in our male couples, this is something that is absolutely necessary. The carriers are also screened, so we're making sure that they are healthy, that they have, their previous pregnancies have not been complicated by anything, because we want them to be healthy and we also want a healthy pregnancy and delivery. And so we always make sure of that as well. They go through testing to make sure that the uterus is normal and can carry a pregnancy. They get clearance from their OB doctors, from maternal fetal medicine, which is like a high risk doctor, to make sure that there's nothing that's going to complicate the pregnancy.
Right. Can you tell us a little bit more about how one finds a gestational carrier and the costs that might be involved with it?
Yeah, absolutely. So gestational carriers typically are found through an agency. Where they kind of have females come to them that are interested and do some of the pre-screening, and then you will make a match, it's called, where you match up with a couple that you're going to carry for. However, there are also situations where people use known gestational carriers. So again, family members, friends that are willing to carry the pregnancy. Again, we have to do all of that special testing and make sure that, everything is good before we can use that carrier. The cost for gestational carrier through an agency, you can correct me if I'm wrong, but you're looking at about $80,000 to $90,000. It's very expensive to use a gestational carrier.
It's unfortunate the cost of that. That cost covers many different aspects. There is reimbursement to the gestational carrier each month while they are carrying the pregnancy. There may be agency fees involved. There is health insurance and all of the prenatal visits that are covered during that. And of course, the cost of the fertility treatment, the embryo transfer. And we know that is a big barrier and a rate limiting factor for many couples. But if it is something that you are looking to pursue and want more information about, we're more than happy to discuss with you strategies and ways our patients have found to make this happen. Yeah. But that's not the only way. So we've talked about ovulation induction with insemination. We've talked about IVF, whether that be co-IVF or using a gestational carrier. But you can also choose to proceed with a donor embryo. And so these are embryos that have already been made, and families have completed their family building and had an excess number of embryos, and rather than discarding them or donating them to research, chose instead to give them to a family who would want to have a child with this embryo instead. And so here at FIH, we have a large database of embryos that are waiting to be chosen. The downside about using the donor embryos is you don't get as much information about where they came from. We have a little bit of information we can share, but because these are private individuals in the community, and they're not commercial donors, right? So they're not willing to necessarily disclose their pictures to us like the commercial egg donors or sperm donors would. But they do give us some information about, their age, how many successful pregnancies they had with this embryo batch, and we can help get a good match for anybody potentially interested in using these. And these donated embryos, some of them are untested, which would be very normal if this comes from a couple or someone who used an egg donor and just had a surplus of embryos. So if the eggs came from a woman who was very young, they're probably not tested. But some of these embryos come from individuals who may be a little bit older, in their 30s. And so those individuals probably did choose to do genetic testing. And so we do have options available for individuals to choose between embryos that we know are chromosomally normal, as well as some of the genders of the embryos. And so that can be a plus too. So if you have a preference for one or the other, these embryos are already made, and you can choose an embryo that way. Yeah. Let's see here. What else have we?
I think we're going to touch a little bit on fertility preservation.
That's yes.
Transitioning.
Yes. Oh, so this is something that we are very much advocates and proponents of. If any individual is consider transitioning or gender reassignment before starting hormonal therapy, doing fertility preservation is something that we want our individuals to consider, because that the hormones associated with transitioning can impair our ability to get a good outcome when it comes to fertility preservation if you were to choose this later on. So if you've been on hormones for 10 years or even 5 years and you want to stop and do fertility treatments or fertility preservation, it does take a washout of all of the hormones that you've been on during that transition, and that can cause some dysphoria and some other problems. And so we like to circumvent that and do the fertility preservation ahead of time. And with that, whether that be cryopreserving sperm or cryopreserving eggs, this would be done very similar to any cisgender individual who would come in and ask for, hey, I want to bank my eggs, or I want to bank my sperm. It would include fertility medications. If you were banking eggs, it does involve a procedure that's done under conscious sedation, so it is under anesthesia. But it's typically a pretty quick process. We do it in just a couple of weeks, and at that point, you're given the green light to proceed with any sort of hormone therapy or gender reassignment surgery that you may want to pursue. Yeah. Does insurance cover that? Do you know?
So insurance will cover some of the treatments that we've talked about today. It's best to always make an appointment and talk to us about your individual situation. However, fertility preservation is not covered by insurance. This goes for not only our transitioning patients, but also cancer patients that preserve their fertility. Just no insurance companies are really covering it. Maybe some of the supplemental insurances.
Maybe there may be a few.
So if you have any supplemental insurances, like specifically for fertility, then that's definitely something that you should ask us to look into, and we're happy to do. But generally, Hawaii-based insurances are not covering fertility preservation. So cost of sperm preservation is much more affordable because we don't have to do much to get the sperm, but egg preservation can be pretty costly as far as, that goes. It's it takes a lot more. There's medication involved, there's ultrasounds, there's an embryology lab that has to take care of the eggs and freeze them. And so it can be a much more in-depth process.
One question that I get from a lot of my individuals who are seeking fertility preservation is they tell me, oh, they had such a great experience here. We're reproductive endocrinologists. Can they continue their transitioning here because we're endocrinologists? And we work with individuals in the community who do that all day, every day. And so at that point, we would typically graduate you back to a provider who would be able to follow you long term, since we focus mostly on fertility preservation and family building here. But when you're ready to come back and build that family, by all means, please come back. And similarly, for questions for gonadectomy or hysterectomies, again, we would refer our individuals back to someone in the community who do those procedures all day, every day for those surgeries. Yeah. All right. And then I think that covers a lot of what we were hoping to talk about today. If you have any other questions, by all means, please give us a shout out here on Facebook. We're happy to answer those questions, or even better, reach out to us. You can text us on Clara, or you can call and set up an appointment. We're more than happy to discuss what the different options are that are available and the processes that are involved. And even if you're thinking about this something for later on down the road, next year or a few years from now, just to give you an idea of what you need to prepare for, go ahead and reach out, and that way you can start your planning right now.
Absolutely.
Yeah, that's a great idea.
Thank you for joining us today. This is an Ask the Docs Fertility Institute of Hawaii live stream. If you have any additional questions, please leave us a comment below, and we hope you will join us again next time. Aloha.
Aloha.